Growth and Development Child Health Nursing. So, first, introduction and concept of growth and development. First, growth. Growth means quantitative changes in body. Increase in size or mass of tissue or body parts and whole body by multiplication of cells. Next, growth in length measures in centimeter, meter, inch, or growth in weight measures in kilogram or pound. Next, development. Development means qualitative changes of body. Physio- in that physiological and functional maturation. It is related to myelination of nervous system. Next, number of cells increases. 60 days fetal life 0.2 into 10 raised to 12 cells. At birth 2 into 10 raised to 12 cells. Next, adult 6 into 10 raised to 13 cells. Next, intrauterine growth influences by growth hormone has no role in intrauterine growth. Tissue growth, it occurs by insulin and insulin-like growth factor first. Next, skeletal growth, it is occur by T4 thyroxine which secretes from 12 weeks onwards of gestation. Next, extrauterine growth influences by growth hormone T4 thyroxine and steroids time at puberty. No role of insulin in IGF first. Next, periods of growth and development and prenatal period. In that zygote, fertilized ovum 0 to 14 days, 2 week. Embryo 40 days, 2 week to 8 weeks. Next, fetus 9 week to birth. Prenatal period 22 weeks, stage of viability of gestation to till 7 days of birth according to WHO. Postnatal period, neonate, first 4 week of life 28 days, early neonatal period, first week of life, first 7 days, late neonate from 7 days to 28 days, infant, first year of life, then toddler 1 to 3 years, preschooler, early childhood 3 to 6 years. Next, school age child, middle childhood 6 to 10 years girls, 6 to 12 years boys, adolescents generally 13 to 18 years. Pre-subpubescent late childhood 10 to 12 years girls, 10 to 12 to 12 to 14 years boys, pubescents 12 to 14 years girls, 14 to 16 years boys, post-pubescent 40 to 80 years girls and 60 to 20 years boys. Then physical growth, weight, normal newborn weight is 2.5 kg or more according to WHO. Newborn lost 10% weight at birth weight in first week of extrauterine life. Due to some problems in adjustment, inadequate feeding, digestive adaptation, and extra loss of cellular fluid. Then 25 to 30 gram per day weight increases during first 5 to 6 months. Next, 15 gram per day weight increases during next 6 to 12 months. Infant's birth weight double in 5 to 6 months, triple in 1 year, 4 times in 2 years, 5 times in 3 years, 10 times in 10 years. Body weight estimation formula 3 months to 2 year age in bracket months plus 9 divided by 2. 2 years to 6 years age is into 2 plus 8. Next 7 year to 12 years is equal to in bracket age into 7 minus 5 divided by 5. Weight or length at birth full term baby is 45 to 50 centimeter. During first 6 months height increases 2.5 centimeters per month and next 6 months to 1.25 centimeter per month. 1 year of age 75 centimeter 50% increases. 2 years of age 85 centimeter. 3 years of age 95 centimeter. 4 years of age 100 centimeter, doubles of birth weight. Next 13 years 150 centimeter, triples of birth weight. Height estimation formula 2 to 12 years, age in years into 6 plus 77 centimeter. Head circumference at birth 33 to 35 centimeter. It should be measured after 48 hours of birth because molding may given false measurement. 3 months 40 centimeter, 2 months 45 centimeter, 2 years 48 centimeter. Then rate of increase in head circumference. First 3 months 2 centimeter per month, 4 to 6 months 1 centimeter per month, 6 to 12 months 0.5 centimeter per month. Next, chest circumference. At birth 30 to 33 centimeter, 3 centimeter less than head circumference. At 1 year of age, head circumference becomes equal to chest circumference. Next, instruments used in measurement. Length measured by infantometer used in age less than 2 years. Height measures by stadiometer, a device used to measure the body height, especially for children. Weight measure of electric weighing machine in hospital practice and Salter scale. कोणची Salter scale in field of practice. Testis size is measured by orchidometer and skin fold thickness by measured by Herpendus calipers. कशाने skin fold is by Herpendus calipers. Next, body proportion. Ratio of upper segment per lower segment of body measured from symphysis pubis are at birth 1.7 is to 1, 3 years 1.3 is to 1, puberty 10 to 12 years 1 is to 1. Vital signs of newborn. Temperature 96.8 to 99 degree Fahrenheit, 36 to 37.2 degrees Celsius. Next, pulse rate apical 120 to 160 beats per minute. Next, respiration 30 to 60, average 40 breaths per minute. Blood pressure 80 to 40 mm of Hg. Then, principles of growth and development. Growth and development is a continuous and orderly process. Growth and development occurs in cephalocaudal direction of head, neck, arm and legs, and proximodistal central to peripheral order. Cephalocaudal म्हणजे direction of head, neck, arm and legs. Next, terms of newborn. Term baby, neonate born between 37 to 42 weeks. Preterm baby, neonate born before 37 weeks. Prematurity, post-term baby, neonate born after 42 weeks. Low birth weight less than 2.5 kg. Very low birth weight less than 1.5 kg. Extremely low birth weight less than 1 kg. Initial care of newborn. Suction. First oropharynx, mouth and then nasopharynx nears. Keep suction pressure 80 mm of Hg to 100 mm of Hg during suctioning. Dry up the newborn and stimulate crying by rubbing the back. Keep head in low position, modified Trendelenburg position immediately after delivery to extract the mucus. Rooming in. Kept the infant in the same hospital, rooming along the mother's immediately after birth. First period of 24 hours of life is called as period of activity. The first period of activity begins with birth and lasts approximately 30 minutes and ends with when infant falls into a deep sleep. Common assessment findings include transient tachypnea, nasal flaring, sternal retractions, crackles, tachycardia, and irregular heart rhythms. The second period of pre-activity begins with when infant awakes from first sleep and usually lasts for 4 to 6 hours. Common assessment findings include sign of excessive respiratory and gastric mucus, hunger, apneic episodes, and the passing of meconium. Then, birthmark. Telangiectatic nevus, stork bites. Red or pink dilated capillaries on eyelid, nose and nape of neck which blanch which blanch easily and more prominent during crying, disappears at 2 years of age. Then Navis primatus, port wine stain. In that a large non-elevated reddish-purple discoloration of face neck may require future surgery. Next, Navis vasculosis, strawberry mark, capillary hemangioma, enlargement of a superficial blood vessels, mainly of head, disappears by age of 7 to 9 years. Then Mongolian spot, bluish black pigmentation on lumbar area and buttocks gradually disappears during 1 to 2 years. Then Harlequin sign, deep pink or red color over one side of newborn's body while other side remain pale or of normal color. This sign may indicate the shunting of blood with a cardiac problem or sepsis. Changes during first week of neonate. 5 to 10% weight loss during first week, which regained by 10 to 14 days after birth. Laningo. Fine downy hairs on the body of fetus start to disappear slowly starting from face. Neonatal mastitis. Swelling in breast of both sex. Neonatal mastitis. Swelling in breast of both sex, boys and girls, and secretion of white viscid can be start to express second and third day onward, which is called as witch's milk. Witch's milk. It is occurs due to presence of maternal steroid hormone in the newborn. Meconium. Green-black color first stool and urine should pass within 24 hours of birth. Umbilical cord. Dry at 5th day and start to fall in 7 days by aseptic gangrenic process. Next, Apgar score, 1 to 5 minutes of birth. First time it was given by Dr. Virginio Apgar in 1953. It performed at 1 and 5 minutes of birth and records it carefully. If Apgar score is less than 7 at 5 minutes, then repeat again after 50 minutes. Repeat until 2 readings become more than 8. 5 vital indicators used in Apgar score are vital signs score in that vital signs in that VGAR. Apgar. A for appearances, skin color. In that 0 score, blue and yellow. Then score 1, body normal pink and extremity blue aqueous. Then score 2, all body normal pink color. Then P for pulse. Then heart rate. Score 0, absent. Less one score is less than 100 beats per minute. Score 2, more than 100 beats per minute. Next, grimace. G for grimace reflex. Reflex or irritability. Score 0, no response. Minimum response, grimace to suction or gentle slap of the soles. 1 score. Good responses by crying. Score 2, cough and sneezing. Then A for activity, muscle tone. 0 for flaccid limb. 1 for some flexion of extremity. 2 for good flexion. R for respiratory efforts, rate. 0 for absent. 1 slow and irregular breathing, weak cry. Score 2, good vigorous crying. Total score is 10. Individual parameter score ranges from 0 to 2. Score 8 to 10 is good and to excellent, no depression, so need to take special measures. Score 4 to 7 is fair, mild depression, immediate oropharynx or nasopharynx suctioning, stimulus to back and stole of feet by gentle rubbing. Administer oxygen may be used if intermittent positive pressure ventilator, if necessary dry and put under radiant warmer heater. Score less than 3, poor condition, severe depression, take tracheal intubation and intermediate positive pressure ventilator, start immediately. After administer epinephrine, cardiac massages if heart rate below 60 beats per minute. Reflexes of newborn or neonatal. An involuntary response by stimulus and involving action called as reflex action. Actions unconditional and predictable responses of newborn that occur to response to specific stimuli. First, sucking reflex. On giving the sucking stimulation, placing finger into mouth, infant start to suck. Appear in 40 weeks of intrauterine life. Disappear at 4 months of if child awakening or 7 months if sleeping. Rooting reflex. On stroking the cheek or touching alongside of the mouth, infant will turn his head to the same side and start to suck. It appears at 34 weeks of intrauterine life and disappears at 3 to 4 months. Then swallowing reflex. Neonate swallow after sucking. Swallowing reflex appears after 34 weeks of intrauterine life. Next. Newborn at 32 to 34 weeks have minor sucking reflex but cannot swallow well, so they have risk of aspiration. Tonic neck reflex or fencing reflex. If head of newborn quickly turn to one side, then arm and leg of same side extended opposite arm and leg are flexed. Disappear within 3 to 4 months. It is absent in brachial palsy. It is a reflex in the if this present reflex present after 6 months, it is abnormal and which indicates spastic cerebral palsy. Then grasp reflex. Newborn grasp if any object put in on palm, palmar reflex, or in soles, plantar reflex, present of at birth and disappears within 4 months, palmar and end month plantar. It may reappear later in life if an individual suffers an injury to the frontal lobes of the brain. Then Moro reflex. When when loud noise when When loud noise is changing position to the newborn semi-sitting position 45 degree to allow the head and trunk to drop back at 30-degree angle and rapid abduction and extension of the arms and fanning of fingers making C shape with thumb and index fingers occurs. Disappears within 3 months in 90% babies. Indicate abnormal neurological abnormality if present after 6 months. Then Babinski reflex. Gentle stroking of the lateral aspect of sole of J shape cause newborn big toes and dorso-reflex downwards and fingers are hyperextended. Disappears in 6 months but it will be normal at 12 months due to incomplete myelination of axon. It is normal reflex if in infants under the age of 6 months, but it indicates lesion of the paramedial corticospinal tract or in older individuals. Plantar reflex or negative Babinski reflex. On stroking of outer aspect of sole from heel to then infant curl fingers and toes towards downward. It disappears at 8th month. Doll's eye reflex. As the head of infant moved to one side, eyes are lag behind and do not adjust to the new position. Disappears at 3 to 4 months. Next, extrusion reflex. When tongue is touched or drip raised, infant respond to forcing outward. Disappears at 4 months. Blink reflex. Sudden closing of the eyelids in response to turning of head, loud noises, bright lights or visual threats. If does not disappear, absence of this reflex occurs blindness and injuries to the cranial nerves, third, fourth and seventh. Gag reflex. Gagging and vomiting results from irritations of the throat or pharynx. It persists of lifelong. Next, parachute reflex. Hold the child upright and then rotate his body quickly as if falling. Infant will extend his arms to break the appear at 6 to 7 months on persistence lifelong. Then breastfeeding. Breast milk is a wholesome food for the baby. It contains all nutrients which are needed by baby during first 6 months of life. Exclusive breastfeeding for first 6 months. Breastfeeding should be started within half an hour to 1 hour of a birth as soon as possible after normal delivery. In case of cesarean section, breastfeeding can start within 4 hours. A mature sucking pattern that can adequately express milk from the breast is not present until 32 to 34 weeks of gestation. However, the coordination between suck, swallow, and breathing is not fully achieved until 37 weeks of gestation. Advantages or benefits of breastfeeding for baby. Breastfeeding rich in sugar lactose, which split into glucose and galactose, and sugar galactose is essential for development of brain or CNS. IgA and lysosome provide immunity to newborn and protect from different type of infection. Lactoferrin inhibit growth of E. coli bacteria and protect the child from gastroenteritis. Lactobacillus bifides inhibits bacterial growth and makes the stool acidic. Para-amino benzoic acid protect the baby from malaria. It contains low and easily digested protein like lactoalbumin, main protein, and lactoglobulin instead of cow's milk. Protein casein, so decreases load on kidney of baby. It contains amino acids like taurine and cysteine, which are important to neurotransmitters. Fats and to breaks milk contain rich amount of monounsaturated fatty acids which decreases risk of atherosclerosis, and polyunsaturated fatty acids which are essential for myelination of nervous system. For mother, lactation amenorrhea suppresses the ovulation, so exclusive breastfeeding serves as a natural contraceptive for 6 months. It lowers the risk of ovarian and breast cancer, helps the mother to lose extra weight gained during pregnancy. It reduces the chance of PPH and promotes speed of inhalation of uterus. Promote emotional bonding between baby and mother, so lower risk of behavioral problems in children. Next, types of breast milk. First is colostrum. Colostrum is a protective milk, yellow and thick milk secreted during first 3 days of delivery, which contain high amount of antibodies IgA and fat soluble vitamin A, D, E, and K. Transitional milk secreted during 4 to 14 days of delivery. It has increases fat and sugar content. Mature milk, thin and watery milk secreted after transitional milk. Milk which is available at starting of regular feeding, which have high amount of protein, sugar, vitamin, minerals, and water. It satisfies the thirst of baby. Hind milk which is available at end of regular feeding, which have high amount of fat and energy. It satisfies the hunger of baby. Preterm milk secreted after preterm delivery. It contains high amount of protein, sodium, iron, mm, immunoglobulin, and calories. Physiology of lactation. Prolactin reflex, milk secretion reflex. Sucking the nipple by baby, stimulation of hypothalamus by afferent nerve. Then increase the release of prolactin into body by anterior pituitary, and milk secretions by the alveolar epithelial cells, acne cells of breast, and milk secretion produces. Sucking the nipple by baby, stimulation of hypothalamus. Then first आपण काय म्हटलं, sucking the nipple of baby, then stimulation of hypothalamus of afferent nerves, then increase the release of prolactin into body of anterior pituitary, milk secretion by alveolar of epithelial cells, acne cells of breast, and milk secretion production. Then oxytocin reflex, let down reflex, milk ejection reflex. Crying of baby or mother's emotions and attention onto baby, stimulation of hypothalamus by afferent neuron, increased secretion of oxytocin by posterior pituitary gland. Contraction of myoepithelial cells around the alveoli of breast, milk ejection into lactopherous sinus and ducts. Suppression of lactation. Bromocriptine 2.5 mg orally, BD for 2x. Bromocriptine increases the secretion of dopamine, also called as prolactin, inhibiting hormone, and dopamine inhibits secretion of prolactin. Due to inhibition of prolactin, suppresses of lactation occurs. Weaning, gradually introduction of a semi-solid food after 6 months or slowly tapering of a baby from breastfeeding called as weaning. Iron stores are depleted at 4 months of age, so breastfeeding infants should give liquid iron supplementation. At 12 months, egg white part can be given. Cheese may use at place of meat. Not fed by baby by honey till age of 12 months because honey may cause botulism. Avoid solid food that may cause choking in infants. Example, nuts, food with seeds, raisins, popcorn and grapes. Secrets of adding solid foods are iron fortified rice cereals, fruits, vegetables and meats. Artificial feeding. Feeding of an infant by preparations other than human milk is called as artificial feeding or a bottle feeding. Composition of human and cow milk gram per 100 ml milk. In that type of milk, human, cow and buffalo. In that human milk, fat is 3.8, cow 4.1 and buffalo 6.5. Protein in human 1.2 gram, cow 3.4 and buffalo 4.3. Lactose 7 in human, 4.4 in cow, 5.1 in buffalo. Calcium 35 mg in human, cow 120 and buffalo 210. Water 88 gram in human, 87 gram in cow, 81 gram in buffalo. Energy 65 calorie 65 calorie in human, 67 kilocalorie in cow and 117 in buffalo. Problems in breastfeeding: inverted nipple, contracted nipple, retracted nipple, sore nipple, flat nipple or short nipple. Contraindications of breastfeeding: temporary and permanent. In that maternal, temporary, acute puerperal illness or cracked nipples. In that temporary, permanent, organic heart lesions, active pulmonary tuberculosis, puerperal psychosis, high doses of antiepileptics and high doses of antiepileptic and antithyroid drugs. Next, neonatal, very low birth weight. Neonatal, in that temporary, very low birth weight, asphyxia, and permanent, severe degree of cleft palate and galactosemia. Galactosemia in an autosomal recessive disorder marked by an inability to metabolize galactose sugar present into human milk because of the congenital absence of one of two enzymes needed for convert galactose to glucose. Then care during cracked nipple. Expose the nipple to air for 1 to 10 to 20 minutes after feeding. Rotate the position of baby for each feeding. Ensure that baby is latched on the areola, not on nipple. Colostrum can expresses after feeding as a moisturizer to prevent cracking or drying of nipple. Avoid use of soap on breast because it may remove natural oil or lubricant which increases the chances of cracked nipple. Care of breast or nipple. Maintain general hygiene and wash of breast once daily. If breast engorgement, feed frequently. Apply warm packs before feeding. Apply ice packs between finger feeding and massage the breast. Use well-fitted bra with breast pads in the bra to absorb any milk leakage. Assist latch. Latch avoided by newborn, audible swelling, type of nipple, comfort of mother, hold or position of baby. Score to evaluate of effectiveness of early breastfeeding. Numerical score of 0, 1 or 2 is assigned to the 5 letters of the acronym. Lower scores more than 5 can indicate the need of assistance for better success of breastfeeding. Next, Baby Friendly Hospital Initiative. BFHI launched by UNICEF and WHO in 1992 promote the breastfeeding worldwide. It contains following 10 steps. Every institute should have a written breastfeeding policy. Train staff to implement this policy. Inform all pregnant mothers about the benefits of breastfeeding. Help the mothers to start breastfeeding within half an hour of delivery. Explain the best technique of breastfeeding. No food or drinks other than breastfeeding. Encourage the practice of rooming in. Encourage the breastfeeding on demand. No artificial teat to babies. Foster the establishment of breastfeeding supports group and inform the mother about it. Any hospital will be called as baby-friendly hospital if following all above mentioned 10 steps. Asphyxia, neonatal respiratory failure in newborn. The inability to of neonate to initiate or maintain spontaneous respiration within 1 minute of birth. It corresponds to Apgar score of 3 or less at 1 minute. It is characterized by progressive hypoxia, hypercapnia, hypoperfusion, and metabolic acidosis. Causes: intrauterine hypoxia and birth trauma. Child features, clinical features. According to level of intensity of clinical features, respiratory depression condition classified as asphyxia livida, stage of cyanosis. Apgar score 4 to 6, mild respiratory depression. Asphyxia pallida, stage of shock. Apgar score 0 to 3, severe respiratory depression, weak and 3D pulse. Pale skin, absence of reflexes along with difficulty into breathing. Management: babies with Apgar score 8 to 10, no need of anything. Babies with Apgar score 5 to 10, give 100% of free flow O2 at 5 liters per minute. Babies with Apgar score below 3 to 4, give positive pressure ventilation with bag and mask for 30 seconds and again reassess. Resuscitation of newborn. Steps of resuscitation are TABC. T for maintenance of temperature, A for establishing an open airway, B for initiating breathing, C for maintaining circulation. Initial steps of resuscitation: dry up the neonate and keep under warmer radiant heater. Position the baby on back and slightly extended neck, 1 inch above mattress. Suction first mouth, then nose. Keep suctioning pressure between 80 mm of Hg to 100 mm of Hg or 100 to 130 cm of water. Give tactile stimulation of to stimulate breathing by slapping or flapping sole of feet or rub by rubbing the back of infant. Bag and mask ventilation. Indication: poor respiratory efforts and heart rate below 100. Procedure: slightly extend baby's neck to ensure open airway. Start to ventilate baby's mask at the rate of 40 to 60 breaths per minute. Evaluate heart rate after giving ventilation with 100% of O2 for 30 seconds. Heart rate above 100, discontinue ventilation and monitor for heart rate, respiration, SpO2 and color. Heart rate 60 to 100, continue ventilation. Heart rate below 60, continue ventilation with 100% O2 and also can start chest compression. Procedure: thumb technique preferable. Use both thumbs. Draw a line between the nipples over sternum to or use lower evolution चलो ना one check the heart rate after evolution. That check the heart rate after 30 second chest compression below 1 year of cheek, brachial plexus and above 1 year carotid pulse. If heart rate below 60, continue chest compression plus BMV plus medication adrenaline epinephrine through endotracheal route. Concentration will be 1 into 10,000. Heart rate 60 or above 60, discontinue chest compression and continue BMV. Next, preterm baby premature. Baby born before 37 weeks to 59 days of gestation, born between 20 20 to 37th week of pregnancy. Categories are extremely preterm, less than 20th week, very preterm, 20 to 32 week, and moderate preterm, 32 to less than 37 week. Assessment of gestational age. Assessment of gestational age of baby can be done by using New Ballard scale. In that New Ballard scale, it is a system for estimating newborn gestational age by rating physical and neuromuscular characteristics of maturity. This scale can be used for neonates born between 20 to 28 weeks of gestation. It includes six neuromuscular markers such as posture, square window, degree of wrist flexion, arm recoil, popliteal angle, degree of knee flexion, scarf sign, ability to extend infant's arm across the chest to opposite order, and heel to ear of extension. Six physical characteristics are also evaluated: skin texture, laryngoplantar, decreased breast nodules, ear forms, and genitals. Combined total score is 0 to 29. The tool is most accurate is performed within first 12 to 20 hours of life. Characteristic of preterm baby: weight is less than 2.5 kg, length is less than 44 cm, small in size. Crown heel length 47 cm or less. Crown rump length 32 cm or less. Breast nodules less than 5 mm wide or may be absent. Absence of testis into scrotal sac, undescended testis or cryptorchidism. Labia majora widely separated in female baby, so labia minora and clitorises are exposed. Nails are short and deep. Decreases are absences in sole of feet. Ears are soft and flat due to absence of cartilage. Scarf sign: premature infants' elbow crosses the elbow midline without resistance as the examiner draws the arm across the chest to the opposite shoulder. Skin covered by abundant lanugo hair and little vernix caseosa. Poor suck and swallow reflex and minimum flexion into extremities. Complication: retrolental fibroplasia, retinopathy or prematurity. High concentration of O2 more than 40% of causes of vasoconstriction which result in hypoxia. Hypoxia causes proliferation of blood vessels which make aqueous humor and vitreous humor turbid. Hemorrhage and edema occurs in retina which detach retina and ultimate cause of blindness. Patent ductus arteriosus, PDA, hyaline disease membrane, pathological jaundice. Management: clamp cord immediately to prevent the hypervolemia. Keep cord length 10 to 12 cm. Give less than 35% of O2 by mask or nasal catheter. Give 1 mg if weight more than 1000 gram of or 0.5 mg if weight less than 1000 gram. Vitamin K by intramuscular. Injection in lateral aspect of midline third of the thigh, vastus lataris muscle. Give neonatal intensive care unit NICU protocol. Keep the baby in a warming device. Incubator temperature is 36 to 37 and 60% humidity. Give additional 20 to 30 milli per kg body weight fluid in phototherapy and in radiant former. Next, postterm. Baby born after 42 weeks of gestation causes high standard of living with sedentary baby habits. Elderly primigravida, age of 30 or above. Clinical manifestation: hypoglycemia, blood glucose level less than 40 mg per decil and polycythemia. Parchment skin. Parchment skin म्हणजे atrophy of skin with a stretching, dry and crackled without lanugo and vernix caseosa. Fingernails are long and extended over ends of fingers. Wasting of subcutaneous fat and muscles in extremities. Increase the risk of cold stress. Dense heavy hairs on scalp. Meconium expulsion and aspiration. long and thin body, meconium staining on nails and umbilical cord. Management: provide normal newborn care, monitor for hypoglycemia and meconium aspiration, maintain newborn's temperature. Next, intrauterine growth retardation (IUGR) or small for date or chronic placental insufficiency. Babies whose birth weight is below the 10th percentile of the average of the gestational age. Causes: causes may be maternal, placental and fetal factors, mother factor, malnutrition, anemia, alcohol, smoking and substance abuse. Toxemia in pregnancy, gestational hypertension, young or old mother below 20 or above 40 years, placental factor, placenta previa or abruptio, etc., fetal factor, genetic or chromosomal abnormalities, low blood O2 and poor weight gain, short stature of mother, multiple gestations and grand multiparity. Types: symmetrical hypoplastic small for dead babies 20%. A generalized proportional reduction in the size of all structures and organs. Fetus affected very rarely in the phase of cellular hyperplasia. Asymmetrical 80%. Disproportional reduction in size of structure. Fetus affected in later month during the phases of cellular hypertrophy. Ponderel's index (PI) used to identify the Ponderel index asymmetrical of IUGR. Ponderel index is equal to weight in gram divided by length in centimeter cube into 100. If Ponderel index less than 2, asymmetrical IUGR. If Ponderel index is more than 2, symmetrical IUGR. Physical features at birth: deficient birth weight 60 gram below the minimum in percentile standards, length unaffected. Next, inappropriate thermoregulation, hypoglycemia and hypocalcemia. Head circumference is relatively larger than the body. Signs of polycythemia, example ruddy appearance, cyanosis and jaundice. Signs of meconium aspiration, old man's look, hypoglycemia and hypocalcemia. Next, features during pregnancy: abnormal fetal growth usually noted during the second trimester. Fundal height is less than expected for the number of gestational weeks. Administer betamethasone 2 doses. Administer betamethasone 2 doses at 80 hours interval of for lung maturity surfactant synthesis. If premature labor in indicated, best to perform episiotomy to prevent intracranial birth injury. Next, prevent hypothermia. Advised to admit a secondary level of newborn if unit of if birth weight is 1500 to 1800 gram, or tertiary level newborn unit if weight less than 1500 gram. Treat at home if birth weight more than 1800 gram. Large for gestational age. A newborn whose birth weight is above the 19th percentile on intrauterine growth curve. Clinical features are birth trauma, respiratory distress, and hypoglycemia. Monitor for signs of hypoglycemia during the first 24 hours after birth. Initiate early feeding. Neonatal hypoglycemia. Abnormal low level of blood glucose level less than 45 mg per dl. Normal level of glucose in first day is to 45 to 60 mg per dl and 15 to 90 mg per dl in older than 1 day. Causes: low birth weight baby and baby or diabetic mother starting feeding late. Then stressful conditions like hypothermia, sepsis, asphyxia and respiratory distress which increases glucose use. Depleted glycogen stores. Clinical manifestation in severe hypoglycemia: increased respiratory and heart rate, tremors and jitteriness, shakiness or seizures, sweating, restlessness and hypothermia. Apnea with cyanosis and may be present in preterm babies. Management: start breastfeeding within 1 hour for delivery as soon as possible in warm environment. So symptomatic infant with convulsions, administer 2 ml kg per 10% dextrose IV as a bolus. Symptomatic infants without convulsions administer 2 ml per kg of 10% dextrose IV bolus over 1 minute. After giving bolus dose, give infusion of dextrose at rate of 7 mg per kg per minute. If hypoglycemia continues, administer medication of diazoxide, a drug used to lower blood pressure in acute hypertension emergencies and to treat hypoglycemia due to the hyperinsulinism or octreotide to decrease insulin secretion. Next, tetanus neonatum. Tetanus neonatum is an eighth day of disease, infection of umbilical stump navel after birth by Clostridium tetani. Cause Clostridium tetani, it produces the neurotoxin tetanospasmin, which causes tetanus. Source of infection of soil, horse and cow dung, an instrument used during labor. Next, new non-sterile techniques on enlightening and the umbilical cord. Clinical manifestation. First symptoms appears after 7 days of birth. Refusal or to feed and apathy. Common initial symptoms: keeping mouth open, jack jaw or triceps, tonic spasms of muscles of jaw masters due to disturbance of trigeminal nerve. Fifth, cranial nerves, jaw unable to open. Rhesus Rhesus sardonis. Rhesus sardonis, a peculiar grain as seen in tetanus caused by acute facial spasm. Razor lips due to facial muscle spasm. It is so exposed the teeth like a stupid smile. Opistomus, body become like opistance. Management: active immunizations of pregnant women with 2 TT injections. Administer human tetanus antitoxin antibody against Clostridium tetani 500 units. Keep the room well ventilated, peaceful, and dim lighted because photophobia. Stop oral feeding and start IV fluids. Start nasogastric tube feeding 3 to 4 days after starting treatment. Next, ophthalmia neonatum. Ophthalmia neonatum, inflammation of the conjunctiva during first 3 weeks of life. Mode of infection: infection of the birth canal at the time of delivery. Infected hands of caregiver. Causes: Neisseria gonorrhea. Symptoms develop within 48 hours of age. It is rare but very serious. Chlamydia trachomatis. कशामुळे होते? Chlamydia trachomatis होते. Symptoms develops after 5 days is very common. Other agents are Streptococcus, Staphylococcus, Herpes simplex, etc. Clinical manifestations: watery mucus, purulent of discharge, sticky or swollen eyes. Management: give eye care to the newborn by sterile swabs, moist and with normal saline, inner canthus to outer canthus. Administer sopramycin eye drop. Administer prophylactic erythromycin ophthalmic ointment. Crates method. In that Crates method, use of 1% silver nitrate solution instilled into the newborn's eyes immediately after birth for the prevention of ophthalmia neonatum, gonorrheal ophthalmia. Next, respiratory distress syndrome. It is a serious lung disorder of newborn due to immaturity of lung and inability to produce the surfactant. Clinical manifestation: features of respiratory distress like tachypnea, nasal flaring, expiratory grunting, rib retraction, seesaw respiration, hypoxia, pallor and cyanosis, acidosis of hypothermia. Management: administer surfactant replacement therapy through endotracheal tube. Monitor ABG, take sample for umbilical artery and oxygen saturation level. Administer oxygen at lowest possible concentration to avoid the retinal damage, retinopathy and prematurity. Next, fetal alcohol syndrome, FAS, fetal alcohol spectrum disorder, FASD, birth defects of tetrogenesis, an infant born to a mother who consumed of alcohol during gestation. Clinical message: small head with multiple facial abnormalities like small eyes with short slides, low nasal bridge, short palpebral fissures, hypoplastic philtrum, short and upturned nose, thin upper lip, etc. Abnormal palmar crease, respiratory distress, congenital heart disorder, tremors for feeding and seizures. Management: advice to mother to avoid alcohol consumption and smoking during pregnancy, position newborn on side to drain secretions, monitor for respiratory distress and hypoglycemia.